يلا
تمام.
احنا ممكن نبدأ بقى دلوقتي يا دكتور محمود.
تمام.
Yes, your case please.
Uh, I have to read the case or
Yes, please. Yes.
طيب. Okay. I just okay. Okay. Miss Kathy Brington, aged 30 years old.
Mrs.
Kathy
Yes, Kathy Brighton.
Brighton, aged 30 years old. This woman has had 2 episodes of angioedema. The most recent one, which occurred following dental treatment, required overnight hospital admission. She also has recurrent abdominal pain, thought to be due to irritable bowel syndrome. I wonder if she has had an مش مكملة.
Had a cause for this? For your kind case.
Okay. Shall I start, Dr. Sharif?
Yes.
Okay. Good evening, Miss Kathy.
Mrs. Kathy, Mrs.
Mrs.
Okay, I am Mrs. Kathy. Yes, good evening, doctor.
I'm Dr. Mahmoud. I'm one of the doctors here. Supposed to discuss your condition today. Is it okay with you?
Yes, doctor, please.
First of all, can I confirm your name and age, please?
Yes, I'm Kathy Brighton and I'm 30 years old.
Nice to meet you, Miss Kathy.
Okay, nice to meet you, doctor.
I have a letter from your GP stating that you have 2 episodes of what we call angioedema or allergy. Can you tell me more about this?
Yes, doctor, it happened 2 times. One time when the last one was following dental extraction. I found that I started to have swelling on my face and of my tongue, and also I started to have hoarseness of my voice. And the first time when I took a medicine, I cannot remember the name of this medicine actually, but I took a medicine and this medicine caused also the same symptoms. I found that my face became swollen and also my tongue with also some hoarseness of my voice. So my GP referred me to you.
Okay, Ms. Kathy, I'm really sorry about this, and I'm going to help you today. So just a few questions with regard to your condition. Have you ever had such a condition in the childhood, or like allergy or any kind of allergy?
No, doctor. It just started like all in all within the last 6 weeks.
Okay. And do these 2 conditions similar? The symptoms are the same?
Yes.
Okay. Like I would just do like if you do any skin eruptions?
Yes, sometimes yes, doctor.
Okay. We'll go more for this. Was it painful?
No.
Itchy?
Yes, doctor.
It was itchy. Okay. And was it oozing any blood or any discharge?
No, doctor. No.
Okay. Was it numbing? Hello?
No, doctor.
Okay. In all over the body or specific part of the body?
No.
All over the body, the rashes, I mean? Or only in somebody's like hands only, or?
No, doctor. Only in the hands.
Only hands. Okay. Is there anything increase this one, like trauma, for example? Anything triggering this at that time?
You mean the swelling on my face?
Yes, that was because of the dental extraction. This is one of the causes. Any other thing increase or decrease this one? These rashes?
I'm not sure, doctor. I'm not sure.
Okay. So at that time there was lip swelling, right?
Maybe, doctor, some stresses. I'm not sure, but maybe some stresses. I'm not sure.
That's
Yes.
I wanted to ask.
Yes, there is lip
Sometimes
swelling. Yes, there is lip swelling.
so the stress one of the also triggering. Okay, there is lip swelling and shortness of breath at that time. Shortness of breath.
Yes, doctor.
Shortness of breath. And any noisy shifts also.
Yes.
And hoarseness of voice.
Yes, doctor.
Feeling your voice is hushed. Okay. I'll go also through some other questions with regard to your condition. That any fever at that time?
No.
Any bumps or lumps in your body?
No, doctor.
Any tummy pain?
No.
No tummy pain. Or loose motion?
No tummy pain, no loose motions. Only the last attack was accompanied by tummy pain.
Last one. Okay. And any joint pain or swelling?
Yes, sometimes yes, doctor. Yes, sometimes I have joint pain.
Okay, I'm really sorry about this. And any awareness of heartbeat or chest pain?
No.
Okay. Any puffy eyes?
No, doctor.
Or a change in the water work, like frothy urine?
No, doctor. Only the puffy eyes are coming with the attack only.
Only during the attack. Okay. And any pins or needles in your body during that?
No.
Okay. Do you feel that sometimes you have shaky hands or sweating?
No.
Okay. For your medical background or for your health in general, I want to ask you also some questions with regard to that. Any medical condition that you have in the past, like for example, bronchial asthma or eczema or skin allergy?
Yes, doctor. I am working in a shop that is selling cosmetics and creams and all accessories for females and so on, perfumes and so on. So with some creams and perfumes, while trying them, I get some allergy in my skin.
Okay, but the same attack, like lip swelling, shortness of breath, or only for the site of cream?
No.
The cream.
Most of the times it is at the site of the swelling, at the site of the application of the cream, and at the same time also sometimes like having some chest tightness with it.
Okay, when you apply it in a large area of skin.
Yes, I'm trying the creams for the customers.
Okay. Any other medical conditions? Diabetes, hypertension, for example?
No.
Okay. Are you taking any medications for any reason?
No, doctor.
Do you have any allergy to any medicine before? You said you take antibiotic and it was like medication, and you are not sure about it, but you are not sure.
Yes.
Was in the form of tablet or injection or what?
Yes. Once I had this problem, I was having difficulty of breathing, so they give me an injection.
Okay. Any food allergy?
No.
Okay. Any admission to the ER because of that situation or any other situations?
Yes,
emergency, I mean.
Yes. I was admitted last time. As I told you, I was admitted to the ER and they gave me an injection to relieve this shortness of breath and also to reduce the swelling on my face and tongue.
Okay. You remember the injection or you are not sure about it?
No.
Okay. In your family, do you have any family history of similar condition?
I'm not sure about that.
Okay. Any family history of bronchial asthma or skin allergy?
Yes, doctor. My mother is asthmatic and my sister is also having what we call it urticaria.
Okay. Uh, do you smoke?
Yes, doctor.
So, how many cigarettes per day?
10 cigarettes per day.
Okay. Would you like to refer you to smoking cessation clinic to discuss this? You might have
Okay,
a
doctor.
chance
I
to
will.
work for it. Okay.
Yes. Okay, doctor. No
Okay.
problem. I will think about it.
Thank you. I plan for that. Are you? Do you drink or are you alcoholic?
No, doctor.
Okay. Sorry for this question. Are you taking any recreational drugs?
No, doctor.
Okay. I'll go back for the stress you told me. You told sometimes you have stress at home. What kind of stress you mean?
Yes, doctor. I am a single mother, and I have also a son who is suffering from autism. So, the kids with autism, they are always talking, they are always playing, they sometimes distract things and so on. This causes a lot of stress, and he's sleeping also a little. So, this caused me also not to sleep very well. And this is my stress of life, and that's why my blood pressure was high during the last 6 months. And the doctor gave me a medicine, and he told me this is to control your blood pressure. But unfortunately, this medicine caused, after some time, this attack of swelling of my face and my lips, and caused also so short of breath for me. So the doctor in ER advised me not to take this medicine again.
Okay, I'm really sorry about this. For first of all, and I'm going to help you in that way to find a solution for your stress. And I will review, of course, with you this medicine. What about your job? What do you do for life?
Yes, doctor. I am, as I told you, I am working as a receptionist in a cosmetic shop.
Sorry, you told me already. Is it doing some impacts on your job as you have some problem? Because this is your main job, I know. It's like stress also in your job because of that, right?
Yes, not very stressful.
Okay.
I'm selling perfumes, doctor, and creams.
Okay. I also I will explain that to you also, and I will discuss this with you later. Can you tell me what's your main concern today, Ms. Kathy?
Yes, my concern is about these symptoms. What exactly I do have, and what is the treatment for this? I don't want this attack to come back again to me. I don't want to have this attack again, doctor.
I really appreciate your concern, and of course, I'm here to help you to find a solution for that. For your condition, I don't have a fixed professional diagnosis, but it's suggesting that you have allergy. It might be what we call angiodema. Have you ever heard about this?
No, doctor.
It's a medical term for a medical condition which runs in family and manifested by what you had, like the lip swelling, sometimes when you're exposed to certain triggers. Additionally, you might also have, because you have family history of asthma and skin allergy in your mother and your daughter, your sister, sorry. You might have also a kind of disease called allergic urticaria. And also that need to be confirmed. Additionally, in your history, you are taking medicine which is for blood pressure. I suggest maybe it's one kind of this medicine called ACE inhibitor. Anyway, don't bother yourself by this medicine, but I will review with you this medicine, and it might be one of the causes also of your allergy. So, to conclude, we are going to have a plan for that, starting by examining you. It means blood pressure, everything. I'll review your medicine. I will see this medicine, of course. And I request you to do some blood works to confirm the diagnosis, and some advice with regard, or maybe skin test also. I advise you also to, as much as you can, avoid the triggers like applying the cream or exposed to that kind of triggers. To tell the people around you about your condition, because if you are in the serious condition, they can help you at that way. I will also refer you to allergy doctor, and he might give you a pen, and he will train you to have to use this pen in case of emergency situation like that one. So you start to feel it, you can use the pen easily. They will train you. It's very simple to use. And so far everything is clear for you.
Yes, doctor, very clear. Thank you.
Thank you, Raskati. Can I know how much you get from our conversation today?
Yes, you told me that I have a condition called most likely angioedema, and this condition is an allergic condition, and you will try to reduce the stresses of my life, and also at the same time you will refer me to an allergy doctor who will prescribe some medicine for you, and also he will prescribe some emergency medicine for me, and he will follow me up, and you will also see me again after some time.
Exactly. Just to add to you also, additionally, I will give you some brochures, leaflets, and websites to search for that. Of course, as a confirming the diagnosis, I will leave you with you also the contact number of the hospital. Appointment will be arranged, of course. Additionally, for your stressful condition, I will refer you to the social worker, and also to help you to cope with your son condition also.
Okay, doctor.
And occupational is also for you to adjust your job. Would you like to ask me anything or anything in your mind?
No, doctor. Thank you very much.
Thank you, Mr. Khan. Nice to meet you, and we'll arrange I will start our plan now.
Okay, nice to meet you, Dr. Mahmoud. Okay, very well done. What is your differential diagnosis, Dr. Mahmoud?
My differential diagnosis might be angioedema, dermatitis, contact dermatitis. I will put contact dermatitis. Contact dermatitis, maybe. There is some conditions like mastocytosis, which is maybe cutaneous or systemic, but it will be less with this scenario. Also, it can be some systemic conditions related, but I asked already about, like hyperthyroidism, lymphoma. It comes with some symptoms similar to this case, but it will be also the bottom of my list.
Yes. Yes. So what the blood works you will do for this patient?
I will do simple blood works like CBC, inflammatory markers, and I'll go specifically for and of course liver function, kidney function, and go specifically for the diagnosis, searching for C1 and C4 or complements in general, because in some conditions they have low C1 and 4 but normal complements 3. I will also refer to the immunologist to do skin allergy test specifically for that, or maybe skin biopsy from that if there is an obvious lesion or obvious eruptions. I will also. That's it. This is the most important investigations in my mind.
Yes. Will you admit this patient or discharge this patient?
This patient is not in acute situation now, but I need to do my blood works and confirmatory test, and I will train the patient. I will not leave the patient move without the trained on the EpiPen or how to use that, and will educate him very well how to avoid the allergen, and in case of starting symptoms, he can use the pen safely. she can use the pain safe.
Okay, very well done يا دكتور محمود. This is very common exam scenario. It may came like food allergy, it may came like contact dermatitis, it may came like angioedema, it may came like a misdiagnosis of angioedema, but the actual is contact dermatitis, or the opposite, the diagnosis is contact dermatitis but the patient is having angioedema. You have to know the details of medication the patient already took, and you have also to search for autoimmune diseases, because angioedema sometimes is accompanied with autoimmune disease like SLE. Okay?
تمام.
You have يعني to ask about also a family history of familial Mediterranean fever.
Familiar.
Okay, and you have to ask some few questions about the possible symptoms of SLE.
Okay.
Okay, لكن you did almost cover all the asked points needed to be covered in this case. But an advice for you and for Dr. Jihad is to read this case carefully, because it is a very common exam scenario. As I told you the last session or the last diet, the case was peanut allergy. So as I told you, sometimes it's coming like a peanut allergy, sometimes the scenario is angioedema, sometimes the scenario is contact dermatitis. One time it came a female who has a contact dermatitis. She was diagnosed with angioedema, but actually from the history you find that she has a problem with contact with neck lace at the time of at the site of the necklace, at the site of the bracelets, at the site of the belt, waist belt. There was also an evidence of contact dermatitis. Okay.
تمام.
One time the scenario came as this case, that she's a lady and working in a shop selling the cosmetics, lipsticks and the creams and perfumes and so on. So she was allergic also to those things. And one scenario came that the patient was allergic to food. So the allergy and the angioedema are very common scenarios in the exam. Okay?
تمام.
فيعني very well done إن شاء الله. Only we have to read this scenario again and read the comment on it. And this is only enough for the exam. Okay?
تمام.